Hello. Thank you for tuning in to our Invest North and Central Jersey launch conference. You're about to watch panel number 2, Research and Rules, How Regulation is Affecting the Healthcare Sector. Enjoy.
So let me start off by thanking Capital Analytics and Symphony for hosting the conference and all of you for attending. My name is Kate Clully. I'm a partner at Riker Danzig. I've been with the firm for 23 years. And I head the firm's healthcare group. And we do all three areas of healthcare work. We do litigation, regulatory compliance, and transactional work. And we represent providers from practice groups to facilities. We're here today to talk about how regulations impact healthcare innovation and what needs to change. Now, as a healthcare attorney and as a group, we track just about every proposed and final statute and regulation that impacts healthcare, both on a state and federal level. And I can tell you on a yearly basis, they number in the hundreds. And they tend to be, and I say tend because I don't want to poo-poo all regulations, but they do tend to be a source of consternation for the industry, not just because of the sheer volume of them, but because of their complexity. So we're here today to talk about the regulatory framework in New Jersey with three distinguished guests, and I will let them introduce themselves. But I promise you, it's regulations in New Jersey and in the federal government is a hot topic right now. But we won't be like last night's debate. We'll keep it civil. But Paul, why don't you introduce yourself and we'll go down the line.
Sure, thank you. I'm Paul Martin. I'm with United Healthcare. I'm the CEO of our commercial products in New Jersey, Pennsylvania, and Delaware, and looking forward to a great conversation today.
Good morning, Dr. Andy Anderson. I'm a hospitalist and primary care physician by training, and currently I'm the Chief Medical Officer and Chief Quality Officer of RWJBarnabas Health. Thank you.
Hi, my name is Chris Kozik, and I'm the Chief People Officer for Genmab. We're a biotech company that's focused on the development of oncology and other serious disease antibody therapeutics.
So great, let's get started. I want to start by looking back past couple of years. We've obviously faced a 3-year pandemic. It's increasingly in the rearview mirror. How have your respective organizations changed priorities as a result of that? And what are you focused on today? This is for the entire panel, whoever wants to jump in first.
I can start. I would say we're focused more than ever on our people. The pandemic, truly, as everyone experienced, caused a lot of stress, and it forced us in a good way to be more nimble and to really engage all of our healthcare workers, typically and mostly at the front lines, who are managing many patients and many sick people in our communities. There's a lot of stress that came with that. And trying to have everyone, heal together and then refocus and re-energize in many ways toward what our mission is, which is healthier communities and trying to help our patients get care when they're sick, but also helping our communities be more healthy.
Yeah, from a United Healthcare and a health insurance industry perspective, I think the pandemic made businesses more acutely aware of the health and well-being of their employee population. And really, health insurance right now, I think, needs to be more simple, more transparent, and more affordable. So I think post-pandemic, when you look at it from a health insurance industry standpoint, is how can you impact all of those? Can you make it easier for people to get the care they need? Providing them 24/7 virtual visits, $0 primary care, vital medications like EpiPens, insulin for free. From a provider perspective, reducing friction there and red tape by reducing prior authorizations, making it easier for people to get the care that they need. And then I think lastly, there is an affordability crisis going on in healthcare. And most people who have insurance today can't even afford the deductibles when they need the care. It's a hardship for them. So I think that post-pandemic, the focus has been how can you get people richer first dollar benefits so that they can actually access the care? And that's a direct, if they're healthier and they can have better well-being, you will have a much more productive workforce.
For us, our mission hasn't changed. Our priorities haven't changed. The what remains the same. Patients are waiting for medicine and they can't wait. But the how has changed dramatically. We've needed to rethink almost everything in the way that we promote the elements of our business that have led to value for patients. The ability to drive innovation and create culture and sense of community and strong teams and bring in the right capabilities at the right time in order to bring medicine to the people that need it. And so the pandemic has been a super interesting period of time where it's allowed us to really evaluate all of the ways of working while trying to retain the things that make us productive and ultimately deliver value back out to people. So again, I think just in summary, it's the what remains the same, but the how has changed dramatically.
And that leads to the next topic. So because of COVID, there were a lot of flexibilities implemented in terms of regulations. The regulatory framework, I think, looks different than it did in 2019, especially when you consider telemedicine. But what have you seen in terms of the biggest changes in the regulatory framework since 2019 and how you approach your work? And that's for the panel, whoever wants to jump in.
Well, I think there's been a huge effort for regulators to keep pace with innovation coming out of our industries. And there has been some demonstrated flexibility in novel and adaptive regulatory pathways, such as using real world evidence for approvability, which is allowing innovation to come to patients in the market even quicker. In the private sector and where a lot of innovation is coming, you've got hordes of people and billions of dollars in R&D investment driving speed and driving innovation, and to have regulators try to keep pace with that level of innovation is a daunting proposition. And so I think there have been elements of progress, but there's still a lot of work to do.
Yeah, I think the flexibility that came with the pandemic regarding regulations was powerfully helpful. It enabled us to move faster and to do things that we maybe never would have done otherwise. So, for example, telemedicine was mentioned, and within 2 to 3 weeks, we went from doing 0 telemedicine visits to doing 10,000 a week. And we just pivoted because we had to, and we had the flexibility to do that. So, part of how I think we see things within our health system is there's a lot of innovation, a lot of best practice, and sort of bringing that up to scale it is always the challenge. And with doctors, for example, they say it takes 10 years for evidence to translate into practice, which sounds ridiculous that it takes that long, but it's true in many cases. And what we need to do is to be able to move faster, and having some flexibility in the regulations about how we move faster is always extremely helpful, because we're going to be more innovative. And if I could sort of, a call to action for me would be to allow pockets of innovation, allow people to do some experiments, if you will, watch them very closely, but allow them to be more free, if you will, to try some new things. And then if they work, we'll scale them. We should scale them more quickly. If they don't work, you just stop doing them. But we do need that flexibility in healthcare.
Well, just to follow up on that, do you see some of these flexibilities staying, or I know a lot of them have been expiring, and what are what is the one flexibility that you'd like to see that came out of the pandemic besides telemedicine?
I was going to talk about telemedicine because that for me is important. And just to mention there, partly when we have New Jersey residents who, for example, go on vacation to Florida or somewhere else, and we can't use telemedicine because of regulations in regards to physician licensing, that just limits the ability for individuals to access care when they're traveling. So that, that's one example. Some of the regulations to your question around working top of license would be another example. For example, for dietitians who work in our health system, they can't write orders. They can't write a diet order, which has to be written by the physician. And that's because of regulatory controls, if you will. And there's a safety issue there, of course, but, dietitians, they're experts in diet, and I think they should be able to write orders. So that would be an example of where it would be helpful to have some flexibility in certain areas to allow people to work top of license. Paul.
Yeah, I'll take a little bit of a different spin on it, just in terms of area that you're going to probably see more regulation on. With the Affordable Care Act, there was a lot of regulations around transparency, because healthcare right now is a stress on every business's budget and for consumers. And oftentimes when they experience the healthcare system, they have no idea what they're going to end up paying. They're going to get multiple bills. It's confusing. And I think you're going to start to see a little bit more regulation. What originally came out was transparency on cost. And so all health insurers have to have 500 shoppable services where you can actually see what you're going to be charged for a specific service at a specific physician and what your out-of-pocket is. We were kind of ahead of that at United, giving our members the ability to do that. But even with that capability, it's confusing. And then I think on the provider side, for hospitals, they all have to publish their data. Prices have evolved in a very unique way in healthcare. And I think it's very confusing for just folks to try and understand what's the relative cost if I go certain areas. And there's going to be more regulation on that. New Jersey established the Office of Affordability and Transparency. I think there's going to be more intervention on a state level in terms of understanding. They're going to mandate data be submitted, find out where costs are increasing, try to understand it. And then what I think you're going to see is some regulations evolve from that, where they understand where are prices escalating at significant rates and what can be done about it. What I hope is that there's a broad-based influence in terms of how those regs are ultimately deployed with the medical community, with the health insurers, with all stakeholders, so that you get some balance and common sense policy to try and address that rapid rate of increase. The target over the next 3 years is going to be, low 3% range that people are kind of holding as a benchmark, and that's going to be extremely difficult to try and achieve. But I think it's good aspiration. If you don't measure it, you'll never get there, and you have to have a goal. So I think it's moving in a good direction, but also keeping me up at night in terms of what that will actually result in.
If I could just tag on and very much agree that transparency is a motivator for all of us to get better. And I fully endorse that. And there's the cost transparency. There's also the quality transparency, or, what are our outcomes, and having people be able to see that clearly, it enables them to make a better choice, and it forces us in many ways to get better.
So moving forward to past the pandemic, and what you're seeing a lot now, and it's been happening for the past few years, is a shift to volume-based care, to value-based models. What does that mean for the audience when they're visiting their doctors or looking at what are the best plans to provide their employees? And again, this is for the panel, whoever wants to jump in first.
So I've been hearing about the shift from volume to value for 25 years, and we have shifted some, but not nearly enough. So I think it's really important that we all push that Titanic ship in that direction, because in the end, we're going to have healthier communities, healthier individuals if we focus more on value. And when we say value, we mean prevention, we mean managing chronic disease, not just providing sick care. So, as a health system, we always want to make sure we take care of the sick, but I think in a good way, we're focusing much more on keeping our communities healthy. So we need to keep working toward that. The partnerships with payers, with innovation, biotech, pharmacy, all those things are going to help us if we work together to help keep people healthier. And part of that, again, back to transparency and quality, is understanding what works best and how much that costs, and really implementing best practices.
Paul?
Yeah, I couldn't agree more. And I think it does take partnership from all stakeholders to kind of get better outcomes. I think we're really good at treating people when they're really sick. It's expensive. And I think, the shift that we're seeing and that's positive is, can we work more effectively? We've got an ACO with RWJ, for example, and several other larger systems in the state. And there's been so much opportunity to exchange more information real time with our insured population and self-funded with an organization like RWJ Barnabas, so that we're getting more information and exchanging more information so that we can get in front of high-risk patients or emerging risk patients, or even those patients who've never accessed any care, to make sure that we reach out proactively to make sure that they're doing what they can do before they get acutely ill. And I think that's really the value area that's got the most opportunity. It's too late when their condition has escalated, but there's a lot of opportunity to do more to get in front of people earlier.
I can speak to how you select the right coverage and plans for your company. I think it's really about embracing the access to information and data and analytics that we have today, and appreciating the criticality of healthcare and benefits in your environment. Compensation attracts people and benefits keep them. And I'll explain what I mean. Very few people say, I'd like to take less money for slightly better healthcare. But very many people say, I would like to take more money and I'm willing to sacrifice a little bit on the benefit side. So compensation attracts, but benefits in healthcare is actually a major aspect of keeping people. It's also reflective of your identity as a company and your commitment to your people. But being very targeted and smart about where you make those people investments, getting that value back is absolutely critical. Understanding what your concept in your company of well-being means. What are the programs and benefits that you create and deliver that drive that concept of well-being? And understanding the demographics and the desires and the needs of your workforce, so that you can be very targeted and make the most of your investment. And then from there, you can design the most meaningful plans to your people. It's not a one size fits all.
Thank you. So moving on, there was a lot of growth with hospital systems over the past few years, but what we're starting to read about now with regard to budgetary constraints, you're seeing more hospital closures, hospitals selling assets off like labs. Even though there's a labor shortage in New Jersey, especially with nurses and anesthesiologists, you're seeing more labor cuts in the healthcare industry. What is causing that financial distress, and how can regulators alleviate that? And that's for the entire panel.
Sure. Within our health system, and I think most health systems, we've had increases on the cost side of the equation. I think, as everyone knows, the cost of labor, the cost of supplies have gone up significantly post-pandemic, and that has created, financial stressors. And probably the biggest opportunity is that labor cost, and really having a pipeline of future healthcare workers. We've had shortages with every type of healthcare worker, nurses in particular, where it's quite challenging to attract and retain the workforce that we need. And the salary required to do that has escalated to a point where it's causing significant strain on health systems. And so you're seeing a bit more, I think, of the financial duress and the consolidation as a result of that. So the biggest opportunity is really strengthening that pipeline, and we can take that all the way down into the high schools and colleges and really attracting New Jersey residents to go into healthcare so that we have enough supply.
I mean, one thing that we've observed, and I think retrospectively, it makes a lot of sense, and we could have anticipated, but nonetheless, we were all surprised at the dramatic decline in preventative care and elective care. I was shocked the first year after the pandemic at our insurance renewal rates. Because our utilization was down so significantly, because essentially nobody was going to the doctor, except if you had COVID or something really, really major. And I'm concerned about, not only the financial impact that it has on the healthcare ecosystem, but the downstream impact on the general health of people, and the further financial impact of conditions that could be more significant, or comorbidities, because we didn't catch things quickly because nobody's going for checkups in general anymore. I mean, I'm being very liberal with the way I said that, but you get the idea.
Yeah, and I would say I'm going to stay in my lane in terms of hospital finances and the regulatory impact, because that's not my business. But as a payer, and we contract with all the providers nationally, I think the key thing is to recognize and communicate and understand that is a new dynamic and a new environment today for many providers, because of what Andy talked about in terms of their cost of labor and supplies going up. And from a payer perspective, I think the key thing is to communicate effectively with each of those entities about our contracts and our exchange of value and dollars, and try to be as flexible as possible to make sure that we can get through this tough time right now together. And that takes collaboration, like any business, and flexibility. And I think United has been our outlook on that has been good, and we've been able to successfully renew the vast majority of the contracts that we have, and hopefully ensure financial stability. We need stable providers, partners, and hospital systems.
So moving to the future, we see the evolving nature of the healthcare and life science spaces. Do you believe the current regulations and the ability of the regulatory agencies are capable of keeping up with the pace of changes? And if not, what can they do better?
Sure. Yeah, I would say that, like anything, if you have an industry that's evolving quickly, sometimes regulations move quicker or not. And we have a unique perspective being a national company, and health insurance is regulated on a state basis for insurance. For ASO, obviously, that's ERISA, it's national. We have a lot more flexibility. And I would say that a lot of the regulations that have emerged over time in every state really look at health insurance in a very traditional way, with deductibles, coinsurance, copay, various laws that have been passed for specific coverage for specific conditions. And that's all designed to protect the consumer, make sure insurance companies are solvent. And I think the department does a good job doing that. What I would say is that being in New Jersey and Pennsylvania, for example, and then seeing what's happening across the country, is I would say that I would like to see a little bit quicker approvals on some of the successful products that are resonating. We have a product right now, it's called Surest. There's no deductibles and there's no coinsurance. It is a strictly copay plan. And it's really designed to have people pay less out of their pocket for higher value providers. And it's fastest growing product that we've launched. Many self-funded national accounts have it. We're selling a lot of it in Pennsylvania. It's not approved in New Jersey today. We are working to try and change that because essentially it kind of checks the boxes I talked about earlier: simplicity, transparency, and affordability. What we found with the product is that members like it better because it's simpler to use and they know before they go what they're going to pay for any particular service. Employers save money on it. And just the construct of the current regulations around member cost shares do not fit that box. So we've got it approved in like 31 states right now, but it's not here, and we're working on it. But that's just an example of something resonating in the marketplace that I believe checks all the major boxes of what people are and businesses are looking for. That's just taken a little bit longer than we'd like to see.
Andy, any final thoughts?
Well, the general answer is simplify, because things are too complicated. The one specific thought there for health systems as an example is the New Jersey Hospital Association is a representative body that helps to sort of prioritize, and if the regulators could listen, carefully to organizations like New Jersey Hospital Association, that's a voice that will say, this is what's most important. And this is what's holding us back. And if you could help us and partner, then we can move faster and improve health. So that partnership with the New Jersey Hospital Association would be one example.
Chris, any final thoughts?
Look, I had mentioned it before. I think, the pace of innovation for regulators needs to keep pace with the innovation that's coming out of our industries and new technologies. And I plan to talk about, AI a bit later, but there are technologies that are coming that are going to and are revolutionizing the quality and speed that we're able to deliver innovation. If regulatory bodies are not keeping up with the pace and the level of impact that those revolutions will have, we won't keep behind. So we need to collaborate, we need to communicate and try to keep proportionate pace with each other.
Well, thank you for participating in the panel. Enjoyed the conversation. Hope you guys